Welcome back. It's 7:41. There's research that finds a link between COVID-19 and obstructive sleep apnea. And another question, can that natural sleep aid, melatonin, the hormone, help prevent severe COVID-19 from occurring? Here to discuss both is Dr. Joseph Ojile of the Clayton Sleep Institute. Good morning, doctor.
Good morning, John. How are you today?
I'm doing fantastic.
And Merry Christmas, my friend.
Thank you. I hope you had a wonderful holiday. And we're hearing about sleeping during the holiday and getting a good night's sleep and how important that is with COVID-19. Let's begin with sleep apnea. Can it make you more susceptible to contracting COVID-19?
Well, there's this recent study out. They looked at over 9,500 charts of people that were in the hospital or infected with COVID-19. And of interest is it appears that the diagnosis of obstructive sleep apnea made you about 8 times more susceptible to catching COVID-19, probably about 4 times more susceptible to being hospitalized and twice as risky for having respiratory failure. So this is a retrospective study, but it's data that's quite interesting. And so it does appear based on these data that there is concern that obstructive sleep apnea is a risk factor for COVID-19 infection and for more serious infection. So the take home is, of course, for our people that have been diagnosed with obstructive sleep apnea to make sure they continue their therapy appropriately, continue being followed by physicians, and also for the millions of people that are undiagnosed to begin the process of becoming diagnosed and treated, because it's quite simple and easy to make the diagnosis and to get on therapy.
Good to know. I've also heard that sleeping prone on your stomach, if you've got COVID-19, it helps, because most people, if you think you're sleeping on your back, that affects your lungs more, and you give them a break when you're sleeping on your stomach.
Well, actually, John, you're on top of things. The prone sleep, prone positioning, we call that, for people that were having difficulty breathing in the hospital has really changed the course of the disease for the hospitalized patient and allowed thousands of patients to stay off the mechanical ventilation by putting them on their stomachs and allowing them to lay that way or sleep that way. So that has been a big change in therapy after the first several months of the epidemic.
And our old friend melatonin, it's a natural hormone, usually comes in 5 to 10 milligrams. I'm hearing more and more about this being floated as a possible treatment for COVID-19. It helps reduce the intensity of it. What have you heard about that?
Well, so there's interesting information coming out about melatonin, and as you mentioned, it is a naturally occurring hormone. There is some suggestion that might have some anti-inflammatory properties. Of course, it's natural. We have used it, of course, as you and I have discussed over the years. We use it commonly. There is some contention of trying to use it almost as a preventive, like taking a very low dose, like the 3 milligram tablet at bedtime in a preventive method. They're doing that with vitamin D and zinc currently. We haven't been recommending that for all patients, but for folks that are interested or have another reason to use it, say they have some mild sleep issues, we think it's a reasonable approach. The other thing that came out of that long studied article that we discussed, you and I, over the weekend, is that the question on melatonin, is it really getting at the issue that maintaining good sleep health
is that the most important
helps
thing,
your
right?
immune system? Exactly. And that's one of the things we've been encouraging people during this time. And they talked about it in this article again, is structure, structure, structure. It's very difficult to maintain healthy sleep habits when people are all at home.
Yeah.
The holidays cause that. And so the focus on that, and if melatonin will help people with that, then I'm for that. Now, you want to take melatonin for sleep induction to help you get to sleep about 60 to 90 minutes before you go to sleep. So if you're going to go to the store, it's over the counter, of course. If you want to get the 3 milligram tablet, take it about 60 to 90 minutes before you want to go to sleep. And then it'll be rising in your bloodstream right as you go to sleep, which is how melatonin works.
Doctor, I've been reading so much about this, and it's fascinating, the connection between sleep or lack of and COVID-19. My friends who have had COVID-19, they're up, like when I'm up at 1:30 in the morning. Normally they wouldn't be. And so it's doing something to our sleep schedules, our natural circadian rhythm, as we call it. And I think it's fascinating, and these studies will continue well beyond once the vaccine takes effect.
I would agree. And John, you're spot on. We are seeing this regularly in the office now. People that have had COVID-19, but they're now having they had a lot of sleep problems during the actual infection. They were either very sleepy, but had disrupted sleep. And now they're having ongoing either awakenings at night or disrupted sleep. And we'll find out over time, but there's a suggestion that this could be some ongoing inflammation in the nerve cells that have to do with sleep or that take the signals up to get you to sleep.
Right.
And but we are seeing that clinically already in the office. So you're right on target.
Yeah, just a reminder, continue to hydrate and try sleeping on your stomach. Give your lungs a break. Dr. Ojile, thanks so much. We appreciate it.
Thank you, John.
And we're going to have all of this information posted to our website at fox2now.com and something to think about throughout the day.